I can still see a lot of cameras on. If everyone can please turn off the cameras. Okay, so Divya, we can start doing the Facebook Live.
Yeah, I have Divya.
Okay, good evening, everyone. So today we have with us Dr. Suhaila Kapoor and Bhavna Vidhara, and they are going to be conducting this session for us. Bhavna, over to you.
Thank you so much, Rinki. Thanks very much. A warm welcome, everyone. As we go live with our series called Need of the Hour, CII Delhi and CII IWN, we are very, very pleased to be collaborating on this Need of the Hour series, where we bring doctors, thought leaders, and field experts to share their knowledge with you, the viewer, to also dispel some myths and take the fear out of this pandemic. Today, we have with us Dr. Suhaila Kapoor. Suhaila Kapoor is a researcher, she's a neurobiologist, and she's also founder of the startup called HealthSafe. Suhaila, it is a privilege to have you with us today. A warm welcome.
Thank you so much, Bhavna. It is indeed my own honor to be actually here today. I really want to thank CII IWN for hosting me here today and trying to bust the various myths around COVID and also bringing to the fore the absolutely novel research which is going on. So it's a fantastic experience, and CII and CII IWN, thank you so much for hosting me here today.
Thank you, Suhaila. Thanks very much. So Suhaila, we are going to just dive into it. We're going to start off with asking you some questions. I'm going to start off while we get, while the audience gets their questions going. I'll start off with some of my own questions. Typically, I mean, the topic of today is how COVID affects the brain. So everybody knows that COVID hits the lungs.
Yes.
Everybody knows that, COVID is hitting your immune system and everybody's got fever, cough, these kinds of manifestations. But I think lesser known perhaps is the link between COVID and the brain. So can I just start off with asking you, is there a link? Is there any sort of link between COVID and the brain?
Unfortunately, there is. I think this pandemic has given rise to so many challenges. Respiratory challenges have been, of course, the biggest one. We've heard recent events of cardiac challenges coming in, and neurological challenges, or the ones affecting our brain, is unfortunately a third category. And we are seeing a lot of patients now suffering from a myriad of brain related disorders. And I think the research is going on at this point of time to try and find why, what, how.
Wow. Yeah, it is new, right? Corona.
It is new.
It's a very young thing. Can I just request everybody who's joining us now to please put yourselves on mute and turn the cameras off. Thank you so much. So Suhaila, since it is new, tell me something. How would you even be able to explain it or experience it, or shed some light on that?
I am actually glad you're asking me this. If you just look at coronaviruses historically, it's not the first time we've had a COVID or a coronavirus attack. Even in the past, there have been two pretty significant instances where coronavirus was seen across the world's population. In 2002, we did have something called the SARS, which is the severe acute respiratory disorder. In 2012, we had something which is called MERS, which is the Middle Eastern respiratory disorder again. And both of these infections are from also a coronavirus family. So it's not the first time, we are seeing a pandemic. Of course, it is the sheer scale of COVID-19, which is, is also called SARS-CoV-2, which is what is so worrisome. But SARS-CoV-1, which is the first SARS, which was in 2002, followed and then went on till about 2003, again starting in also Asia. MERS started in the Middle Eastern countries in Saudi Arabia, which was in 2012 and 13. And in 2019, we have COVID-19, going up till even 21. So there are quite a few learnings which we can extrapolate and borrow and try and use similar research, settings and findings to see if we have similar outcomes also in the case of COVID. While of course, data is coming in fresh and new, but there is history to also, learn from and borrow ideas from. So it's not the first time. And if I may also just highlight a little bit, because all of these three viruses come from also bats. So there is a similarity there. All these three, SARS-1, SARS-CoV-2, which is now, and also MERS. So there is a lot of similarity across these three viruses. And while like neurological conditions were seen in SARS and MERS both, and they were really, really small numbers. So there was a 0.04% of people who had SARS who also had, like brain like related disorders, and 0.2% with, who were like MERS patients who had similar findings. If you look at the sheer scale of COVID-19, the pandemic has hit so many, millions of people. So even if we just saw these very small percentages, we'll be looking at hundreds of thousands of people who are going to go on and have similar disorders, which is going to be a huge, challenge on our like healthcare and our socioeconomic system really in the future. So, there is a lot of learning to borrow from there.
Fantastic. At least we have some sort of frame of reference in a way. So
Absolutely.
Thank you for explaining that. And also you're right. They all originated from bats. Yeah. So tell me something, what are the most common manifestations of neurological symptoms or the evidence of neurological impact?
So if you look at the first symptom, which I think a lot of us are familiar with, which is loss of our sense of smell, or like anosmia, as it's called, ageusia, which is for, taste, which has been talked a lot about. It's one of the first symptoms which a lot of people have, experienced. So if you think of it, our sense of smell and taste comes from our central nervous system. Our brain is the one which kind of commands and dictates that. So there would definitely be some kind of implication. Now, one of the simplified ways of understanding is that the COVID-19 virus affects the endothelial cells in our noses, mucosal membrane. So we have a mucous membrane inside our nasal cavity, and COVID affects that. It's called chorrhea. So in chorrhea, you would definitely see inflammation, which might be compounding our loss of sense of smell and loss of sense of taste. But there are a lot of patients who have not shown clinical manifestations of COVID. So they don't have the very typical respiratory outcomes, and they've gone on to show anosmia and also loss of taste, which shows that the virus might be traveling inside the brain through the optic nerve fibers, as they're the ones which originate in our nose, and then they go up inside the brain. So that might be one of the various routes of viral infection, which is one of the first symptoms which a lot of patients experience. A lot of other cases have also been seen of something which is called encephalopathy, which is swelling inside our brain, which goes on to manifest in the form of of several physiological or physical deficits. So people might be experiencing loss of motion, ataxia, very much dizziness, drowsiness, insomnolence, so excessive sleepiness or lack also of sleep. Some of them have also gone on to show a lot of cases of cerebrovascular diseases. So what is also called a stroke. So it could be either a bleeder kind of a stroke, which is hemorrhagic stroke, or a clot, which is called ischemic stroke. So there are a lot of cases which are now being brought to the fore of patients who either showing stroke. Sure.
I'm going to stop you here.
No, please. I was just enumerating. I understand that. Yeah, I know. There's a lot of research going on. So if I can just put it down in simple words, there is swelling inside our brain, inside the brain of any COVID-19 patient who does show neurological outcomes, which leads to, several symptoms, which are now being, investigated further.
Okay. So I just want to ask you, because you've touched upon this sequentially. So the loss of smell, that you and taste, right?
Yeah.
One, is that something that is reversed? And if so, how long does it take typically?
So I think it does get reversed as per the current findings. It might take anything from a couple of weeks to a couple of months. It's surprising to know, but our brain is a fairly plastic organ. Despite age, the plasticity continues. We've got something called stem cells in our brain. Heard of them? I don't know if people have heard of stem cells, but they are like a mother cell. They kind of give rise to various other cells, and stem cells induce plasticity, so they confer plasticity. And if there is damage, it takes a while for this plasticity to come work into action, and and kind of in a way reverse whatever deficit there has been. But so anywhere between a couple of weeks to, I would say 3 or 4 weeks onwards, till about a couple of months. So if the damage is really, really not, very, very harsh, you can, a lot of patients are experiencing a reversal of the sense of smell and taste. It's not something which is gone forever. Hopefully.
Okay.
Again, I must put a disclaimer. These are all research findings, so there is active research going on. So whatever I'm, highlighting or quoting is based on like several publications and like researchers working worldwide. So things might just keep on changing, and I'm happy to keep bringing to you the updated information as it comes about.
Right. So it's dynamic.
It's dynamic.
And you spoke about encephalopathy. So let's just go.
Yes.
Touched upon. Very quickly, can you tell us, so what happens? You said that it means, dizziness that way,
Yes.
and maybe even disorientation, perhaps.
Absolutely.
So, so how does that reverse itself once the COVID is out, or like what does it take to alter that?
So encephalopathy is not something which would go off on its own. Steroids are something which are being, recommended for all kind of like inflammatory diseases, including COVID. So one of the typical treatment plans which is given right after somebody starts showing symptoms of like encephalopathy would be a high dose of like steroids, of course, all under medical supervision. But that's one of the first treatments which can kind of, bring down inflammation inside the brain and try and like reverse these, effects very, very like gradually. But there is a plethora of these effects, and some of them might sustain for a slightly longer time. Some of them might go off faster. So it's going to be kind of a mixed bunch.
Okay. Can I ask you to just explain the connection between the brain and the nervous system?
Okay, sure,
Thank
absolutely.
you so much.
So the nervous system comprises of two major portions: the central nervous system and a peripheral nervous system. So the nervous system in our body has two portions: the central nervous system and our peripheral nervous system. The central nervous system is it is a brain. So it's where the brain comprises the so-called CNS, and the nerves which originate from our brain and go into our spinal cord and then throughout our body is the like peripheral nervous system. So the brain is a part of our like nervous system. There are two parts, central and peripheral. So the brain is not disjointed from any of the other nervous system aspects. Nerves originate in our brain and they pass down into the various organs, into the various muscles, glands, etc., etc.
Okay. So, okay, I want to ask you, so scholars have linked SARS and MERS and other
Sure.
neurological conditions such as seizures, loss of movement, coma.
Mm-hmm.
Are we seeing comorbidities arise as a cause of COVID rather than, comorbidities get COVID? I'm asking you the reverse. Is that also happening?
So that's what I was basically talking about. Comorbidities such as neurological conditions, the ones I've just mentioned, encephalopathy, stroke, and many others are all a cause of COVID. These people might have a predisposition to having stroke or to having encephalopathy because of either like genetic, like factors, or factors such as, hypertension, diabetes, hypercholesteremia, very high cholesterol level, levels in the body. So people who have certain underlying conditions such as diabetes or hypertension go on to have COVID, they have a much, much higher risk of, having encephalopathy or stroke or many other neuropsychiatric conditions as well, such as, anxiety, PTSD, seizures. So it's not just one. Like I said, it's, a fairly mixed bunch, and it's very dynamic. Every patient might come up with a novel symptom, a novel condition, and it's really one like leading to the other. But I think the question to also ask is, do people having neurological conditions have a high predisposition towards outcomes from COVID? And that's something, if you look at it the other way. So let's say like a schizophrenic, for example. So let me put it like this. One of the highest risk factors of dying from COVID is age. Unfortunately, the older a patient is, the higher chance of them passing away due to, COVID and like succumbing to it. The second highest risk factor of, succumbing to COVID is having a schizophrenic condition. So like schizophrenics, unfortunately, which is again a neuropsychiatric condition, are the second most vulnerable population in the entire world who can die from, COVID. And this is because, like schizophrenia and many other brain-related disorders, they're on a prescription medication, which is it's kind of, like immunosuppressant.
Hmm.
So what happens is they've been on these immunosuppressants for a while, and then they go on to have COVID, and the body cannot fight the COVID infection well enough. So they end up succumbing to it. The other thing is also behavioral, right?
Sorry,
So
what
a
did
lot
you
of
say?
schizophrenics may not
You-
come
you-
back for us. It's also a behavioral issue. Sorry, am I audible? It's also a behavioral
Yeah.
issue. So a lot of people who have neurological or psychiatric conditions may not be in a state of mind to actually, take on, try and maintain the kind of behavior, like required during COVID, which is like social distancing, wearing masks. So if they don't do that, they become extremely more like vulnerable to also COVID outcomes. So I think it's going both ways, people with comorbidity suffering from COVID and people from COVID showing like neurological outcomes.
Okay, wonderful. I'm going to start taking some audience questions.
Sure.
So this is from Nandini. So are brain strokes something to look out for?
Yes, absolutely, Nandini. If there are signs of numbness or weakness in the person's face, arms, or legs, if there is sudden confusion, a delirious state, a speech disability, understanding, comprehension disability, if the person cannot see from one or both of the eyes, these are definitely, warning signs that somebody might be experiencing a mini or a major stroke. So there are something called mini strokes, and, just also elaborating on this since this question's come up. It's called a mini infarct. These are very small transient strokes which happen. So a small blood clot gets lodged in one of the arteries, and it might just move away after some time, but it might show a few symptoms. So the person might experience, lack of coherence or lack of comprehension or dizziness for a very short time, and then they might become okay. And they might think, oh, nothing really happened. But in actuality, this was actually a small infarct or a small stroke. And this shows that the person has a tendency or a predisposition to keep having these, infarcts over and over again. So
can I just ask you one thing? Would this show up on a scan? Like
it would show up on a scan. An MRI is where it would. Of course, it has to be of a size, but on most typical mini infarcts do show up on, like MRI scans. So that's one of the diagnostic tests to get done. If you notice somebody in the family who's, kind of having a repeated set of these symptoms, would be to go and get them an MRI done, a brain MRI, and the radiologist would be able to tell you that. Okay. Absolutely.
Wonderful. So then you were saying that there are two kinds.
So there is a mini infarct, and the other is a full-blown infarct, where there is a clot which gets lodged and it doesn't move, and the person goes through, either unconsciousness, falling into paralysis, a comatose condition. So full-blown infarct is way more, easy for the family to diagnose and know that something is going on. But it's the smaller or the mini infarcts, which one needs to be more careful about and more attentive to, especially in COVID patients. Now that we know that these strokes are happening in quite a few cases.
Okay, wonderful. Thank you. We've got Samyukta asking, how does the lack of oxygen affect? How does the lack of oxygen?
Sure.
Affect the brain?
Affect the brain. So, okay, so let's understand that all cells require oxygen to stay alive. And if the cell does not receive oxygen, it's going to die out soon. Now, what's really a stroke is the loss of blood, reaching into a part within our brain. Now, oxygen is carried by blood, and blood carries nutrition and oxygen both. So it carries water, nutrition, and oxygen. And now, if oxygen is not going to reach to a certain area in our brain, there is going to be a deficit which is going to start happening, and eventually the cells are going to start dying. So lack of oxygen or hypoxia, as a lot of us are now even seeing, we keep taking our blood oximeters, testing the SpO2 levels, is basically a telltale. So if there is very high hypoxemia, which is lack of oxygen in our blood, it can lead to more generalized hypoxia in the body and even inside our brain, thus causing a stroke. So hypoxia is one of the main reasons why a stroke happens, really.
So this SpO2 that we talk about,
it
was less than, say, what number are you at risk?
So I think clinically what they're saying is if the SpO2 values fall beyond 90 and for a sustained amount of time is when one should start, watching out and start seeking emergency care. There are strategies to, try and manage SpO2 levels like 90 and above.
Mm.
But definitely for a sustained amount of time, if the person is showing SpO2 levels under 90 or even borderline 90, it would be a good time to visit the like ER services and
Right.
start, or at least speak to a doctor on via video consult or whatever.
Right. So, and so
Start,
if
availing
I've
that
heard you
medical care.
correctly, basically you're saying that if it goes down, then one of the impacts could be a stroke.
It
right?
could be a stroke, yeah.
Wow.
And if it's for a long duration, it definitely could be a stroke, yes.
Okay. Before I take another question, I have one quick question for you.
Sure.
Is there nerve damage as a consequence?
Yes. Neuropathy, so our nerves have a sheath around them. It's called a myelin sheath. It helps in conduction. So the nerves send electrical signals. I'm sorry, I'm going to get a little theoretical, but this is my
please.
forte. This is my area of research. And I think being a researcher, I need to explain to people, how does the brain work? So the brain transmits chemicals from one area into another. These chemicals are basically ions. So they are like neurotransmitters, which cause a change in the ions. I don't know if you've heard of, K plus or hydrogen positive ion or a sodium positive ion. And these ions, when they're moving, they cause electrical currents. Any ion which is moving across a passage is basically a current being passed down from a plus sign to a minus sign, just the way we have in our like wires in our, homes. Now, all signals are passed in the brain through these ions, which cause electrical stimulus. And if you think of it, there is a nerve which originates in our brain, but extends up to my like finger's tip. Now, that's a single nerve which is extending from my brain into my finger's tip. And that's a long, long path. If you think of it, if you think of a nerve originating from our brain into our foot's, say a toenail tip. So that's actually it's actually a single nerve fiber. Now, if you had such a long distance to, traverse, it would take a very, very long time. Imagine you've just stepped on say a pin and your foot just jerks back within a nanosecond, right? It doesn't even take us a fraction of a second to, take action. How does it happen so fast is because we have a myelin sheath. This is a layer of lipids or fats around our like nerves, and the nerve or the like electrical signal jumps, and it can get conducted very, very fast across this whole myelin sheath. Now, what you said about nerve damage, in COVID, a lot of patients are showing ataxia or movement disorders. They're showing, tingling sensation in their like fingertips, in their skin area, which means the myelin sheath or neuropathy, as it's also called, has started happening in some COVID patients, and thus is going to, cause further ensue and cause further more like nerve like damage and worsen the whole situation, really.
And is that reversible?
It's a hard call, actually. So nerve damage and to what degree and to what extent it happens, it is a difficult thing to reverse. It can, again, depending on the brain, on the person's age. So of course, the younger you are, the way more plastic the brain is, there is a chance for like reversal. But as we grow older, the plasticity becomes less and less, and the compensation would take a lot, longer time. And plus your like nutritional input, your like environmental stimulus, all of that combined really, works this out.
Yeah. Okay, we're just going to take more audience questions.
Sure.
Quite a few. So from Nandini, when you talk about stem cells, do you think that stem cell therapy can be used to cure COVID-19?
No, so it's not to cure COVID-19, it's to cure a stroke. So you're not going to be able to cure stem cell. You can't use stem cell therapy to cure COVID-19. I don't know if a stem cell therapy comes up to cure the kind of like lung based like damage which we are seeing. But as far as the brain is comes, which I'm pretty confident about, you have both external stem cells which can be transplanted in the brain, which is being actively researched world over, and you have you have also like endogenous or like internal stem cells which can be activated. So we already have stem cells within us. You can activate them through different, like medicines, antioxidants, supplements, and make them do the work. So not to cure COVID, but to cure a stroke or like neuropathy or encephalopathy. Yes.
Okay,
you
great.
can employ
Thank
stem
you so
cells.
much. Thank you. From Nidhi Agarwal, we've got after COVID, people experience depression and foggy mind. Please,
Yes. No, that's true. It's a lot of anxiety and mood disorders have been observed during COVID. It's again a result of, could be hypoxia. There's a lot of inflammation happening within the brain, which can be causing, the so-called like anxiety or say a mood disorder. A lot of people have been experiencing PTSD or post-traumatic stress disorder, as is also called. And a lot of this symptoms start showing up a few weeks after the COVID infection. So it may not happen in a concomitant manner. It might just take a few days or a few weeks for the actual infection to start. Sorry, for the actual say a symptom to start showing up. And it's very, very well characterized that people with COVID are showing anxiety and depression and neuropsychiatric conditions. Yeah.
Wow. Okay. Okay, we're going to move to the next question because we've got so many. A lot of people who are suffering from corona are dying of heart failures. This is from Randeep. What's the connection?
Yeah. So this is a new symptom. This is a new unfortunate incidence which is being. So what's happening in COVID is that the coagulation of the blood is seeming to increase. So there's a lot of doctors now recommending a test which is called ferritin or a D-dimer test.
Yeah.
The D-dimer and the ferritin are basically to detect how much is the blood coagulating and forming clots. So when it coagulates, it forms clots. It somehow seems to be that the coagulation proteins, the ones which promote coagulation, are going up in the COVID patients. And again, if somebody has comorbidities such as diabetes or hypertension or cardiac disease, there is a very high chance of these particular clots forming inside the person's body and traveling to the heart and causing a cardiac arrest. If the clot traveled to our brain, it would cause a stroke. So there are, this is a very high incidence, and it's somehow coming across to be a commonly seen symptom now, of like COVID, where there are a lot of cardiac arrests which are being observed.
It is, I don't think there's any part of the body that is being left.
No.
So from Sipping Thoughts, we've got, is the impact short-term or long-term?
It's mostly a long-term impact, especially like neurological conditions may not start right away. They might take a few days or a couple of weeks to start showing the symptoms. It's not to say that people may not have these symptoms before COVID and then go on to have COVID. So, but a lot of patients are showing a neurological deficit a few days or a few weeks after COVID. And the implications are very, very far reaching. So if I can just, elucidate on this a little bit, There are patients of Parkinson's, Alzheimer's, and dementia in whom COVID has known to, exacerbate the conditions massively. So typically the disease might have taken a few years to worsen and for the patient to show the extreme symptoms. But now with most COVID patients, it's happening a lot faster. So something which might have taken years now, probably would just take a few odd months for the person to start showing extremely, aggressive symptoms of any of these vascular diseases, like neurological vascular diseases, really.
Okay, thank you. Now we've got from Rinki, she's asking, what are the diagnostic tests to be done to detect brain damage?
Yeah, so one of the key ones would be imaging. So if there is a person who is showing fogginess, delirium, repeated, all those symptoms which I just mentioned, MRI would be the first thing to get done, really. You can also image our arteries and veins, which are going inside the brain. It's called arteriovenous imaging, or MRA, which is a magnetic resonance angiogram. You can also get that done. A CT scan would be another, a CT brain, not a CT chest or a CT lungs, which a lot of patients are seeing. Then there are some pathological or biochemical tests which can be done. So you can, extract CSF, which is the cerebrospinal fluid. It's the fluid inside our brain. It can be extracted through, I think, a needle biopsy and sent for analysis. And you can also see inflammatory markers in the CSF and see if there is any sort of damage which can be detected from that. Plus, there is a host of nerve conduction studies, because you also asked about, nerve damage.
Yes.
So there are also nerve conduction studies which can be done. But again, it would be hard for any of these studies to show definitive markers, early on. It would take a little bit of time for them to start showing, serious outcomes, really, and to be able to diagnose them. Yeah.
Wow. Okay. Sadhana, we've got, is insomnia after COVID also a possibility?
Yes.
How does it take to become normal? Any things that can be done?
Yeah, so insomnia is another challenge with a lot of patients are experiencing post-COVID. Again, you know, with a medical consult, there are certain like relaxants and sedatives which can be which could be administered. Possibly, I wouldn't want to give a statement here since I'm not from that background. But there is a lot of behavioral like therapy and counseling which can also come to aid. Plus, I think certain sleep hygiene practices just help with also insomnia. So it's going to be a mix of drug-based treatment with some amount of behavioral therapy. But it does affect our sleep cycle. Yeah.
Thank you. From Kiran, we've got, do these symptoms happen while you are COVID positive or later?
It could happen both. So a lot of the patients, and based on the massive research which is going on, it's about anywhere between 6 to 10 days. Most of these symptoms have been observed. So past the day 0 of the COVID infection, which is the day of your test, it's about from anywhere between 6 to 10 days to about 2 weeks when the neurological symptoms may start showing up. But like I said, there is a bunch of patients who have not shown clinical manifestation in terms of a respiratory outcome, but they have gone on to just show like nervous system like disorders also. So
Wow.
yeah, so but anywhere between 6 days onwards is when most of these like studies allude that you would have like neurological outcomes showing up.
Okay, thank you. From Priyanka, we've got, is the effect on the brain different between different age groups or genders with regard to the COVID?
Yes, that's a very valid question. So definitely a higher age is a higher risk. Most of the people who are from the older age category have a much higher risk towards, stroke, ischemic stroke, hemorrhagic stroke, something called deep vein thrombosis, which is also being noticed. Now that's one, but then there are very young patients who have passed away due to stroke post a COVID infection. And they might be having some other clinical, a comorbidity or some sort of a condition which, has made the condition really worse for them. But definitely older age is a much higher risk factor. Also, in the case of gender, men show a much higher predisposition to stroke as compared to women. Women have certain, like protective mechanisms in our body just by virtue of our like genetics. So most of these stroke studies have shown that men have a higher predisposition of, succumbing from a stroke or a cardiac event post-COVID.
Interesting. Okay, so Rinky's asking, are people with prior neurological conditions showing different outcomes to COVID?
Yes, like I just mentioned, like schizophrenia is one of them. If the patient has a predisposition for a cerebrovascular disease, such as, they already have been having mini infarcts or mini transient ischemic,
or
strokes.
Parkinson's or anything
or
else,
Parkinson's, all of them.
Yeah.
So like I said, Parkinson's, Alzheimer's, dementia, they are all exacerbated post, COVID. Schizophrenia is another one. And that's been a phenomenal study, because to know that there is an entire population out there who are at such a high risk of succumbing due to COVID. And of course, people who have predisposition to, previous strokes would be the highest risk, risk category as well. They would also fall into the high risk category.
Okay, thank you. So Hira, just one thing as a time check, we are 55 minutes, but if it's okay with you, we'll just continue to take a few more questions.
Yes, let's just go ahead. Absolutely. I'm happy addressing the ones I can at least.
Thank you so much. We appreciate that. So we've got from Divya. So if one has insomnia for 3 weeks, even after COVID, should one be testing for something? Thank you.
I would recommend a neurological consult for this, because most insomnia cases, most insomnia episodes are known to start within the second week or so, like I just mentioned, which is day 7 onwards, really. So if somebody's been having it for 3 weeks, I'm not sure about the severity, so I wouldn't want to jump the gun here, but I would definitely say do take a medical consult, and if there are any other associated symptoms along with also insomnia. Because let me also say that, COVID has brought with it a lot of panic, a lot of paranoia.
Yeah.
So insomnia may not be just because of, a brain, say a deficit, but it might actually be due to just the panic which is going on. Also, we're over inundated with so much information. We are hearing this news all the time, and that might be also having the kind of effect we are seeing in terms of, bad sleep cycles, very high anxiety. So do take a medical consult. You can just take a video consult. You don't have to visit the hospital for this, and let your clinician know about any other symptoms that you might be experiencing along with insomnia.
Okay. Nidhi's asked regarding the mind fog and clouding, what should one do?
What should one do regarding the mind fog and clogging? I think you just need to gradually wait it out. Like I mentioned, steroids are something which are administered right away when somebody starts showing encephalopathy or stroke-like symptoms. Steroids take some time to take effect, but when they do and the brain inflammation would come down, is when the fogging would kind of it would become less, gradually. But again, I would have the same response: take a consult and put yourself at ease, and that would help you. But steroids do take some time to start showing effect. So expecting that you've had a steroid today and probably 2 days later, you're absolutely fine may not be the case. It might just take a couple of more days.
Okay, wonderful. We're just going to crank through some more questions because we've got a lot to go through. So Jasleen has asked, can something be done to prevent or delay the onset of the neurological damage that might have resulted due to COVID?
Yes, I think that's a really good question. And I think, unfortunately, I don't have a straight answer, which is, purely evidence-based. I can parrot out a list of things somebody who is COVID positive could do to try and delay or offset neurological symptoms, but these are not evidence-based.
Could you just say 3 or 5 things?
Yes, I think one would be definite. So if it's a stroke, it would be hard to put that off. That's not something which is going to be easy to put off, right? But if it is any of the neuropsychiatric conditions, probably, which are more behavioral and less life-threatening. Again, schizophrenia is, like I've just pointed out, but say anxiety disorder or post-traumatic stress disorder, those can be offset a little bit. Again, on the using counseling with a lot of family support, and I think also a relatively good diet and a sleep cycle, a sleep hygiene practice. Now that also depends on how advanced is this person's COVID infection. Is this person really capable of doing any of these things? If they're still COVID positive, they are still in the ICU, you can't really expect them to, be having any sort of counseling. So
No, so basically to prevent or delay the onset, you can just ensure that you get good sleep, eat well. Yes. And is there anything else? A third thing that they can do?
Thought diet would be probably another thing which can be definitely focused on. But again, like I said, strokes and cardiac arrests, and these are not things which are easy to manage like this.
Right. Okay. And we'll be doing a separate session on diet. So
absolutely.
We'll be saving that.
You'll elaborate on that. Absolutely.
Yeah.
I don't want to get it.
Zia has a question. If your ferritin is high and the D-dimer is normal, is there something to worry about?
I'm going to say this with something which a lot of doctors told me. Again, this is not based on hardcore data, but on just my own experience. If there are no strong symptoms of any of the things which I mentioned, so, like delirium, dizziness, fogginess, weakness, ataxia, speech impairment, comprehension impairment, don't try and read too much into every biochemical test, because also understand that during any viral infection, these parameters are going to be, up and down. It's not that, even if you had just a common cold, and you had a fever, 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 and you had and if you got the IL-6 done or the ferritin done or a D-dimer done, these parameters are going to be up and down. So instead of reading too much into saying my ferritin is high, but my D-dimer is low, or the other way around, because both ferritin and D-dimer are basically tests to show, like clotting. Don't treat so much. Observe your symptoms for a while and take a medical consult. But don't panic because of that. This is not a reason to panic at all. IL-6 being high is not a reason to panic. D-dimer being marginally high or ferritin being marginally high is not a reason to panic. These are normal outcomes during any kind of a viral infection.
Okay, wonderful. From Jasleen, if someone already has Parkinson's, will it get further aggravated?
Yes, like I just discussed, people with Parkinson's, Alzheimer's, vascular dementia can unfortunately progress much faster down the disease path.
Right. So some people from Ashok, some people are recommending gargling with alum in warm water. Now, alum is known to promote coagulation of blood. So can gargling with alum be harmful?
I wouldn't want to comment on this. I haven't read the publication, and I don't think any of these oral or diet-based therapies should be followed to the T without there being enough scientific evidence about it.
Okay. So we've got another question here. Hold on just a second. Very informative session. Thank you so much. What are symptoms to watch out for in patients who might start showing worsening towards neurological damage? This is again from Jasleen.
Yeah, Jasleen, like we just discussed, weakness, numbness, loss of speech, understanding and also speaking, visual, challenges if the person cannot see from one or both of the eyes, dizziness, loss of balance, lack of coordination, headaches are also another major no. So if you're having, strange, like radiating kind of headaches, and they're happening at a very, very frequent interval, these could be all telltale signs of there being some sort of a neurological damage.
Okay. Now we've got from Mehak, who rightly said, Suhaila, women have protective hormones. Divya has said, if someone has had a brain stroke before or an aneurysm before, are steroids a must?
Sorry, what is a must?
If steroids.
Steroids.
Yes, steroids. Yes.
So steroids are given in, right after the actual event. The person does not need to be on steroids as far as I know. They do need to be on anti-clotting medicine, which is, or anti-hypertension medicine. So most of the people who have strokes or aneurysms are also hypertensives very often. Their blood pressure is quite high, and that might be one of the, underlying conditions why they've had a stroke or an aneurysm. So as far as my understanding goes, chronic steroid administration is not really recommended. In fact, it brings a lot of challenges because steroids are also immunosuppressants.
Yes.
So you don't want the body's immune system weakening at this point of time during COVID infection. So you have to maintain a really fine balance between immunity and inflammation. So your steroids should be administered under a neurologist's guidance for a very, very fixed amount of time. And then also supplement them with some kind of immune boosting drugs, because steroids do suppress our body's immune system.
Wonderful. Thank you so much for this. we're going to close the session. One last question to ask you is there anything we can do as lay people? Is there anything we can do to protect our brain during COVID, post-COVID? Any top 3 suggestions you can give us?
I'm going to say the top 3 suggestions, which I have told my own family to live by. So I truly believe in them. One is going to be mask up. Please keep your masks up, maintain social distance, and do not panic. And I think there are certain things which are in our control, which are these 3 things. Anything beyond this is something probably we cannot control right away. Dropping SpO2 levels is not something to panic, terribly about. There are exercises. There is a prone position exercise. There are, lung muscle strengthening exercises one can do. So don't panic. I remember Glossy saying this also on the previous session, that panic makes the SpO2 fluctuate more and causes more oxygen deprivation. So don't panic, wear a mask, maintain social distancing. And I think we'll be fine. We will somehow ride this wave through as well. Yeah, I would just recommend. Sure, it
Thank
was a pleasure being here. I just want to say there are a lot of questions which I'm sure people have. I would love to stay in touch. I will share my email. It's sohela.kapoor@healthsafetoday.com. Should I just type it out in the section? If people have questions, they should definitely reach out to me. I'll try and address as many as I can. I'm going to type it out right here.
Yeah,
And,
she's already done it. Samyukta's already done it.
Okay, perfect.
Wonderful.
Yeah,
So
Samyukta,
thank you,
so much.
Dr. Suhaila Kapoor, for being with us
Yeah.
at CIIWN today. It's been an absolute eye-opening session. We've learned a lot, and I really appreciate you taking the time and just helping us understand our way through the whole, brain and strokes. Thing with it. It's been fantastic. I myself have learned a lot, and I really appreciate this.
Thank you so much.
And everybody who's joining us, please do join us Monday to Friday. We are live every day with Need of the Hour. And tomorrow we have Dr. Meenal Chaudhary. She's director with Akash Healthcare, and she's going to be talking about let's get the panic out of the pandemic. So please do join us tomorrow, 5:30 p.m. once again. And Dr. Suhaila Kapoor, thanks very much.
Thank you so much for having me here and for a wonderful audience. And I wish you all safe, that you all stay safe and you all stay healthy and we somehow make this through and come out of it victorious.
Thank you so much.
Bye-bye. Take care.
Thank you so much. Divya, you can